Hello everyone, I'm Dr. Priyankita Nath and I'm an anatomy faculty for the online session for the rapid revision series for FMGE. Okay, so I'm going to start today the neuroanatomy in nutshell part 2. In part 1 we have already discussed about the major areas, the sulci, gyri, the parts, okay, and the recent questions which has been asked. Also in the last session where I did a recall on the recent exam on July, there I have already told you about the dural venous sinuses and the questions which has been asked. Okay, so today I am not going to repeat about the venous sinus. Today I will mostly concentrate in the blood supply and the different parts, that is the functional areas. So let us start. Okay, so the functional areas of the brain, you have a very broad classification, that is the Brodmann's classification. Okay, and it has divided the areas and they have numbered the parts, okay, different parts. So we are going to study the functional areas according to the sulci and the gyri present, okay, and according to the lobes. In the frontal lobe, what are the functional areas? In the temporal lobe, what are the functional areas? We are going to study in that way. So you can see in this image, as you can see, the frontal cortex, this area is the frontal cortex, right? Okay, and then you have a central sulcus. You have a central sulcus, as we have discussed earlier. Okay, you have a central sulcus. Now the central sulcus divides the entire brain into the anterior, the frontal, which is your motor, this is a motor, and the posterior, that is your sensory. Okay, now in the frontal lobe, what are the functional areas we are going to get? We are going to study that. Okay. As you can see here in the image, you can see area number 4, okay, area number 6, area number 8, 9 and 10. Okay, these are the numbering. Okay, you can see this 4, 6, 8, 9, 10. Those are in the frontal lobe. These are the functional areas in the frontal lobe. Also, you can see area number 44, area number 45 and area number 47. Okay, we are going to mostly study about this area now. And if you see the medial aspect, so this is the medial aspect. Okay, we have seen these functional areas in the superolateral aspect, and now we are going to see in the medial aspect. Medial aspect also you can see area number 4. This is the area number 4, 6, 8, 9, 10 and 11. And you can also see certain areas here, that is area number, the function area number 24, 23, 33, 2, 32 and 2. Okay, so let us study these functional areas and what are their function one by one. Okay. Okay, so as I told you just now, I have told that the anterior part is your motor part. This is the motor part, primary motor area. Okay, so this is the way it is arranged: leg, arm and face. We'll study about the homunculus later. And in the posterior part, you can see this is the primary sensory area, the primary somatosensory area. Okay, so they have just shown in this image the major areas. So you can see another area here, that is the frontal eye field. Okay, and another area you can see, that is the Broca's area, motor speech area, and the language comprehension area, that is the vernix area. And on the posterior part you will have the primary visual area. All right, so what are the functional areas in the frontal lobe? Okay, so you can see here that in the precentral gyrus, okay, in the precentral gyrus, you have the motor area number 4. Okay, in the superior frontal gyrus, you will have the area number 6 and 8. In the middle frontal also 8, and in the inferior frontal gyrus, very important, you have the Broca's motor speech area number 44, 45. Okay, and if a question comes, it's like regularly asked, if a question comes, the Broca's motor area is present in which gyri? So first of all, you have to remember that it is present in the frontal gyrus. Now among the frontal gyrus, it is present in the inferior frontal gyrus. Okay, it is present in the inferior frontal gyrus. Then if you see in the medial surface as well, so you have the medial frontal gyrus, you have the supplementary motor area 468, then again paracentral lobule, very important. You will have the motor 4, area number 4, and in the cingulate gyrus you have the area number 24 and 32. Okay, and this corresponds to the limbic lobe, the cingulus gyrus. It is in a part of a limbic lobe. Okay. Now in the inferior surface, you have the gyri recti. As we have studied the gyri recti earlier in the orbital surface, you will have it is in the in the orbital surface. So that is a prefrontal area number 9, 10, 11, 12. And in the orbital gyria, you have the medial, posterior, lateral, and anterior gyrus. These are the gyrus present. Okay. So in the frontal lobe, most important is the Broca's, and now you know that the Broca's area is present in the inferior frontal gyrus. Okay, the Broca's area is present in the inferior frontal gyrus. Okay. Where is the frontal eye field? It is area number 8, present in the middle frontal gyrus. They might ask you any question on this. The frontal eye field, area number 8, middle frontal gyrus. Broca's motor speech area, area number 44, 45 in the inferior frontal gyrus. As you can see in this image, area number 44, 45, this is the inferior frontal gyrus. Okay, and this is the middle frontal gyrus. Okay, area number 8. Area number 8 is middle frontal gyrus, 44, 45 is motor speech area, Broca's area. Okay. So, understood? Any doubt on this? Any question? Get asked any question? Okay. So, now you're clear that in the frontal lobe, Broca's area, Broca's motor speech area, area number 44, 45 is in the inferior frontal gyrus. Okay. And about the frontal eye field, it's in the area number 8, that is the middle frontal gyrus. Very important. Okay. These two are the very important question to be asked every time it is repeated. Okay. Okay, let us go to the parietal lobe now. Okay, in the parietal lobe, okay, superolateral surface. So we have the post-central gyrus. Now, where is the post-central gyrus? If you have to see in the image. See, I told you that this is the central sulcus. Central sulcus. Now, it is the demarcation between the anterior motor and the posterior sensory. Now, this area, this gyrus behind the central sulcus, this gyrus is the post-central gyrus. And post-central gyrus has 3 areas, and you have to remember in the sequence 3, 1, 2, not 1, 2, 3. Okay, 3, 1, 2, 3, 1, 2. Okay. And this is the primary somatosensory area. If they ask you about a primary motor area, that is area number 4. If they ask you about a primary somatosensory area, area number 312 in the post-central gyrus. Okay. So, primary somatosensory area, area number 312. Okay. It is in the post-central gyrus. And after primary, you also have an association area. So, somatosensory association area is area number 57. It is in the superior parietal lobule. Now, there is another confusion between the vernix area. Okay. Some are asking whether it is area number 22 or whether it is area number 40, 39, 40. So, we'll come to this doubt later. But for now, try to remember in the inferior parietal lobule, you have a secondary, mind you, the language is secondary somatosensory area. Now, secondary somatosensory area, it is a part of vernix sensory speech area. It's a part, okay? It's a part of vernix sensory area. Okay? Now, if you see in the medial surface, again, the paracentral lobule, okay? Now, the paracentral lobule has both the motor area and the somatosensory area in the medial surface. So, the sensory part here will be your area number 312. And in the precuneus, you have somatosensory association area number 7. ठीक है. So let us see here again. Okay. As you can see here, this is the inferior parietal lobule. Okay. This is the inferior parietal lobule. It has the secondary it is a secondary part. Okay, it is a part of the vernix area. The main vernix area is area number 22, and 40 and 39 is a part of the vernix speech area. Okay, somatosensory part of the vernix speech area, which is secondary. ठीक है, primary is area number 22. So 40 and 39 is present in the inferior parietal lobule, and area number 5 7 is present. This is an association area. This is present in the superior parietal lobule. ठीक है, ये है तुम्हारा parietal lobule. ठीक है, उसके बाद as you can see here, in the medial surface. Now this is important. As I have told you that there is a central sulcus, it is also going to come towards the medial surface. Okay? Now there is an area which is known as the paracentral lobule. This entire area is the paracentral lobule. Okay? And this lobule is mostly concerned with your micturition and defecation. You have to freeze this thing in your mind, that paracentral lobule is for micturition and defecation. So this area has both the motor, it is consisting of both the motor and the sensory area. As you can see, in front of the central sulcus, area number 4 in the medial surface is the motor part, and behind the central sulcus, area number 312 in the medial surface is the somatosensory part, and this entire lobule is for your micturition and defecation. ठीक है? Okay. Let us go to the occipital lobule. Now you know that occipital lobule is mostly concerned with your visual. Okay, now if you see in the superolateral surface, you have a superior occipital gyrus and inferior occipital gyrus. These are the association area. These are area number 18. If there is association, there will be a primary visual area, and primary visual area, as you can see, area number 17, it is in the cuneus and the lingual gyrus, and visual association area is in the area number 18 and 19. So you can see here, this part, the cuneus and the lingual gyrus, area number 17 is for the primary visual cortex, primary visual area, and if it is association, then it is area number 18 and 19. Okay, this is about the visual part. If you see the medial surface, this is the cuneus and the lingual gyrus. In the superolateral surface, you have the occipital gyrus. Also, the visual area, the primary visual area for the macular vision is area number 17, supplied by both MCA and PCA. Important to remember, okay? If some questions might come on the macular sparing as well, the macular sparing, okay? If there is an injury in the posterior cerebral artery, but there is macular sparing, because it is also supplied by the medial cerebral artery. So some question might come on macular sparing as well. Okay? Now about the temporal lobe. Okay, important, very very important. Superolateral surface. In the temporal lobe, again you have the superior temporal gyrus. Okay, middle temporal gyrus and inferior temporal gyrus, and the anterior and posterior temporal gyri, transverse temporal gyri. Okay, so let us see again in the image. Okay, you can see here. So this is a temporal lobe, and now you have the superior temporal gyrus. Okay. उसके बाद you have the middle temporal gyrus and you have the inferior temporal gyrus. Now what is most important here is the area number 22. Okay, area number 22, that is present on the, mostly present on the posterior part. It is present on the posterior part. It is the speech comprehension area. Okay, it is a speech comprehension area. ठीक है, it's the vernic area, it is a speech comprehension area. So that is about the superolateral surface in the temporal lobe. Now, in the inferior surface, we know that you have an orbital part and a tentorial part. Now, in a tentorial part, there is a gyrus which is known as the parahippocampal gyrus, and that gyrus is known as the enterorhinal area, which is area number 28. Okay. You also have in the anterior and posterior transverse temporal gyri the area number 41 and 42. Okay. Now, another important functional area is the taste area, that is gustatory area, area number 44. Asked in the exam, FMGE exam, repeated question, area number 43, gustatory area, and this area is present in the inferior part of the parietal lobule. Okay, posterior to the general sensory area and at the lower end of the postcentral gyrus or in the adjoining area of the insula. Okay, so the gustatory area you can see here in this image. It is in the inferior part of the parietal lobule. Okay, so the gustatory area is present in inferior part of the parietal lobule, area number 43. Okay, area number 43. Here you can see all the main areas. So visual area, it is in the occipital lobe, area number 17, association 18, 19, somatosensory area number 312. Okay. Now olfactory area, area number 28. The main senses you have to know. Okay, it's not necessary that you remember all the areas, but the main areas, the main senses you have to know. So olfaction, area number 28, and it is present in the, just now we have studied the enterorhinal area, parahippocampal gyrus and the uncus. Okay, so if they ask you about the main area, you know that olfactory area, area number 28, visual area 17, 18, 19, gustatory area, area number 43, somatosensory area 312, frontal eye field area number 8, okay, Broca's area 44, 45, and then vernix area, area number 22, okay, 39, 40 are the part, secondary part of your vernix area. So the main primary part for comprehension is area number 22, present in the posterior part of the superior temporal gyrus. Okay, so we have covered the functional areas. Now same question has been repeated. Gustatory cortex is situated in, they have given the option superior temporal gyrus, inferior temporal gyrus, superior frontal gyrus and inferior parietal gyrus. So I want in the chat the answer. Okay, I want the answer. Anybody? Gustatory cortex is situated in, any answer? It's just now we have studied gustatory cortex. Gustatory cortex, area number 43. Anybody in the chat who wants to answer this? Just now we have discussed. Where, in which gyrus, like whether it is in frontal, temporal, parietal, just now we have studied about the gustatory area. Anybody in the chat who wants to answer this? So the answer here is, you know that just now we have studied it is in the parietal gyrus. So the answer will be the inferior parietal gyrus. Okay, gustatory area, area number 43. Yes, the correct answer, yes, you are right. The answer is D, inferior parietal gyrus. Very good. So let us move to a homunculus. So motor homunculus and sensory homunculus. Now what do you mean by this? So if you see the cut section of the brain, the arrangement is in this way: the foot, leg, trunk, then you have the shoulder, then hand, then thumb, neck, face, tongue and swallowing area. This is the homunculus. It's in the opposite way. Similarly in the sensory areas also similar sort of arrangement is there. Okay, now there is a question which came on the homunculus, like on the paracentral lobule. Okay, on the paracentral lobule it came, and for that I am asking you this, that if the paracentral lobule of the brain is involved, then which region of the body will be affected? So they have given the brain and neck, the trunk and leg, trunk and arm, and the perineum and leg. So any answer in the chat? If the paracentral lobule is affected, then which region involved, then which region will be affected? Paracentral lobule. अभी हम लोग ने पढ़ा, means we have studied about the paracentral lobule. I have told you two important things about the paracentral lobule. With that, you can answer this MCQ. So anybody? No, the answer is not trunk and arm. The answer to this, just try to remember, paracentral lobule is concerned with your micturition and defecation. Okay, it's concerned with your micturition and defecation, and with this, if I'm telling you micturition and defecation, you have to mark the answer perineum and leg. Okay, the answer will be perineum and leg. Okay, just freeze this thing in your mind. Paracentral lobule, micturition and defecation. It is just you have to freeze that. Paracentral lobule, micturition, defecation. Area number you have 4 from the motor part and 312 from the sensory part. Okay, and it's concerned with your micturition and defecation. And if there is micturition and defecation, you know that it has to involve the perineum. Okay, so the answer is yes, right? The perineum and leg. Okay. So this only I have just shown you. This is the paracentral lobule which is involved. Okay, and if you see in the homunculus, that's what I was talking. The homunculus. Okay, they have shown the, so paracentral lobule will be present in this part. Let me show you with the red color. This area, right? So it involves the foot and between the hips. So it also involves the perineum. Okay, the homunculus also, it is like you can imagine foot and perineum because it is involved with micturition and defecation. So any other question might also come. So you know that nowadays they are repeating the question, but they are changing the pattern of the question. So if a topic came on paracentral lobule, so you have to study the entire topic because next time the pattern will be changed. They are not going to ask the same question, they will slightly change the pattern. ठीक है, तो इसमें they have told if there is lesion in the paracentral lobule, so there will be weakness and loss of sensation, mind you, in the contralateral lower limb. So in the opposite lower limb, there will be urinary incontinence and fecal incontinence. So micturition and defecation is gone and there will be contralateral paraplegia if there is lesion in the paracentral lobule. ठीक है? Okay. Now, which of the following areas of the brain is not primary sensory cortex? Primary sensory, two words, sensory, primary sensory cortex. Anybody in the chat who wants to answer this? Very easy. Which of the following area in the brain is not the primary sensory cortex? Anybody who wants to answer this? Just think about it. Primary sensory cortex. Primary sensory or somatosensory cortex is area number 312. Just now I have told you, yes, the answer is 4. And the area number 4, is the answer because area number 4 is the motor area. The motor area. Okay? Primary somatosensory area is 312 and 4 is motor area. So the answer is 4. Yes, you are correct. Answer is 4. Okay, now this is an interesting question which has been repeated in 2023. They will be mostly asking you about the Broca's and the Wernicke's area. So a question came, a 62-year-old patient is brought to the emergency room following a suspected stroke. The patient is unable to speak. You have to see the words. The patient is unable to speak fluently. Okay, fluently. He is unable to speak fluently, but he understands the given instruction, which is the probable aphasia in the patient. So whether it is Broca's, Wernicke, conduction and global. So now you know that fluency is gone. Okay, fluency is gone, but there is the ability to understand. ठीक है, now इसमें क्या हो सकता है? तो before that you have to know about this table. In Wernicke aphasia, you have to know about this table. In Wernicke aphasia, Okay, the person will be fluent, but comprehension, okay, will be gone. ठीक है, comprehension will be gone, means ability to understand will be gone, and repetition is also poor. Okay, then there are other type, that is transcortals, where there will fluency, comprehension is gone but repetition is there. In conduction, now in the question there is an option of conduction aphasia, so there is fluency, comprehension is also good but repetition is gone. Okay, and another one which we are concerned is the global aphasia, non-fluent, comprehension gone, repetition gone, everything is gone, global. What about Broca's aphasia? Let's concerned only about these four options. Broca's aphasia, non-fluent, okay, non-fluent, fluency is gone, ठीक है, comprehension is there and repetition is gone. Now see in this question, comprehension means he is able to understand, ठीक है, understand. Comprehension, whenever you get this question, you try to write, they have not mentioned about anything about repetition, they have not mentioned, it's nil. Okay, repetition they have not mentioned, so we'll not think about it, just think fluency is gone and comprehension is there because he is able to understand, ठीक है, fluency is gone and comprehension is there. Okay, so you can also remember the mnemonic as you have told, but instead of the mnemonic, try to remember the table, because next time the question might come on a conduction aphasia or some other type of aphasia, then you will be getting confused. Okay, so fluency is gone, comprehension is okay. Again, let us go to this table. Fluency is gone, comprehension is okay. So the answer will be Broca's. ओके अगर फ्लुएंट होता और समझ में नहीं आता, ओके, इफ द पर्सन इज एबल टू स्पीक फ्लुएंटली बट इज नॉट अंडरस्टैंडिंग, द कॉम्प्रीहेंशन इज गॉन, देन द आंसर वुड हैव बीन वर्निक. कंडक्शन में क्या होता है, रिपीटेशन इज गॉन, ओके, तो दे विल मेंशन अबाउट द रिपीटेशन एज वेल इन कंडक्शन. एंड इन ग्लोबल एफेसिया दे आर गोइंग टू मेंशन एवरीथिंग अबाउट द फ्लुएंसी, कॉम्प्रीहेंशन एंड रिपीटेशन. ठीक है, ग्लोबल में सब कुछ चला जाएगा. So the answer here will be, tell me, the fluency is gone and comprehension is okay. So what will be the answer here? Anyone in the chat, what will be the answer here? Fluency gone, comprehension is okay. Any answer? Any answer in the chat? If the fluency is gone and comprehension is okay, the answer will be your Broca's aphasia. Broca's aphasia. ठीक है, इसका टोटल ऑपोजिट, यस, इसका टोटल ऑपोजिट इज योर वर्निक एफेसिया. वर्निक में क्या होगा, वर्निके में क्या होगा, उसमें फ्लुएंसी इज देयर, द पर्सन इज एबल टू स्पीक वेरी फ्लुएंटली, बट क्या बोल रहा है कुछ समझ में नहीं आ रहा है, हिज कॉम्प्रीहेंशन इज टोटली लॉस्ट. ओके, सो दैट इज वर्निक. इफ द पर्सन इज not able to speak fluently, fluency is gone, comprehension is there, understanding is there, but बोल नहीं पा रहा है, समझ में आ रहा है, that is, just imagine yourself as a student. Okay, imagine yourself as a student in the viva exam. Okay, if you are a student in the viva exam, you are understanding the question, okay, but you are not telling the answer fluently, you are muttering. Okay, ये वो इधर का उधर का आंसर दे रहे हो, तो यू आर मोस्टली जस्ट थिंक अबाउट योर सेल्फ, दैट इज द ब्रोकास एफेसिया. ठीक है, सो इन द वाइवा एग्जाम यू आर फेसिंग द ब्रोकास एफेसिया, बिकॉज फ्लुएंसी तो चला गया है, ठीक है, बट कॉम्प्रीहेंशन समझ में आ रहा है, क्वेश्चन समझ में आ रहा है, पर आंसर बोल नहीं पा रहे हो, सो दैट इज ब्रोकास एफेसिया. ठीक है, कंडक्शन एफेसिया में देयर विल बी मेंशन अबाउट द रिपीटेशन, so it is not mentioned, and in global aphasia the fluency, comprehension and repetition, ओके, ऑल द थ्री विल बी गॉन. सो वाइवा में तुम लोग को हो जाता है ब्रोकास एफेसिया. ब्रोकास का टोटली ऑपोजिट है वर्निक्स एफेसिया. ट्राई टू रिमेंबर वन. अगर तुम लोग ने एक याद रख लिया, जैसे ब्रोकास, लाइक इन वाइवा समझ में आ रहा है वाइवा का क्वेश्चन, बट आंसर बोल नहीं पा रहे हो, मतलब कॉम्प्रिहेंशन इज देयर, फ्लुएंसी इज गॉन, ब्रोकास उसका टोटली ऑपोजिट इज वर्निक्स, कंडक्शन में रिपीटेशन इज गॉन, तो वो मेंशन रहेगा। एंड ग्लोबल एफिशिएंसी में फ्लुएंसी, कॉम्प्रिहेंशन, रिपीटेशन, एवरीथिंग विल बी खत्म। ग्लोबल मतलब ऑल द पार्ट्स विल बी गॉन, ठीक है। So same thing they have mentioned here, classification of aphasia. You can remember the table. So just now we have told, like if there is a fluent one and there is a non-fluent one. If there is fluent one, so you might have two type of aphasia. अगर language comprehension intact है, so you might have conduction, जहाँ repetition will be gone, and you might also have anomic aphasia. There will be repetition of words, phrases are good, okay. And in if the language comprehension is impaired, you will have wernic or transcortal. So you can just remember that global everything will be gone, and in the Broca's it is non-fluent. You might also have transcortal motor aphasias. Okay, so we have, I've already mentioned. Now this table is important for you. Try to remember this table because Broca's area lesion kahan kahan hota hai. Just now I have told that Broca's area is the inferior frontal gyrus. Okay, inferior frontal gyrus, and the vernix aphasia, it is in the superior temporal posterior part, area number 22. Conduction is mostly in the arcuate fasciculus. Okay, conduction aphasia, arcuate fasciculus, supramarginal gyrus, ठीक है. Anomic mostly in the angular gyrus. Global is in the middle cerebral artery territory. Transcortical also same, entry and superior to Broca's area. If motor, if sensory, it is a watershed area of middle and posterior cerebral artery. And you might also have isolation aphasia. But what is important is the Broca's area, area number 44, 45, and vernix area, area number 22. Try to remember a dictum. Okay, Broca 44, and you divide it by 2, वर्निक area number 22, ठीक है. 44, 45, वर्निक area number 22, ठीक है. वर्निक का डबल हो जाता है ब्रोकास एरिया, area number 44. वर्निक is area number 2 in 22. Every time you can remember this, वर्निक area number 22 and ब्रोका उसका डबल, that is 44 and 45 as well, ठीक है. Yes. Okay. Now let us come to the white matter of the cerebrum. So you know that there are different type of fibers in the white matter. So you have three types, mostly the association fibers, the commissural fibers, and the projection fibers. So let us study about these fibers one by one. Okay. So association fibers, what do you mean by association fibers? Now interconnect different region of, each word is important, different region of cerebral cortex in the same hemisphere. So in the right cerebral hemisphere, they are going to interconnect different region. So that is your intrahemispheric fibers. Intrahemispheric fibers in the same cerebral hemisphere but different region. Okay. So in the same cerebral hemisphere but in different regions. So there are short association fibers, those are the arcuate fibers or arcuate fasciculars, and the long association, that is the gyri of the different lobe. Now a question might come on this important thing. Okay, conduction aphasia. In the conduction aphasia, your arcuate fasciculus is gone mostly. So the wernic and the Broca's area, okay, the Broca's area and the wernic areas, those are connected by this arcuate fasciculus, and arcuate fasciculus is a association fiber. Okay, arcuate fasciculus. Now Broca's and wernic in the same cerebral hemisphere, same side, okay, same side of the cerebral hemisphere. So you can see that it is intrahemispheric, as I told you, in the same cerebral hemisphere. So Broca's and wernics are connected by the arcuate fasciculus, and arcuate fasciculus is your association area. Okay? Arcuate fasciculus is the association area. If you see on the long association fibers, as we have studied about the short association fibers, that is arcuate fasciculus, in the long association, you might have the cingulate gyrus, the cingulum. Okay, it is present on the medial surface, cingulum. Okay, and it is located in the cingulate gyrus, and this is a part of your Papis circuit of the limbic system. Okay, the cingulate gyrus, the cingulum is a part of the Papis circuit of the limbic system. Then you have uncinate superior longitudinal, inferior longitudinal, fronto-occipital, and the perpendicular fasciculus. So these are the long association fibers, and cingulum is also a type of your association fiber. If you come to the commissural fiber, the very most important largest commissural fiber is the corpus callosum. आता है every time in exam. Corpus callosum is the longest, largest commissural fibers connecting the two hemisphere of the cerebrum, है ना? So interconnect. What is the words here? They interconnect identical cortical areas of your two cerebral hemisphere. Okay, of the two cerebral hemisphere. It is not of the same cerebral hemisphere. The same cerebral hemisphere में दो different areas connect कर रहा है. On the right side they are connecting only my Wernicke and the Broca's, then it is your association fiber. If the connection is from the right to the left cerebral hemisphere, it is your interhemispheric fibers, and those are commissural fibers. You try to remember that the corpus callosum, if you cut the brain through the sagittal suture, that's sagittal plane, then you can see that it is connected by the largest commissural fiber, that is the corpus callosum. And then you have the anterior commissure. Okay, you have the anterior commissure, the posterior commissure, then the hippocampal commissure, and the habenular commissure. Okay, so okay, this time they have asked about corpus callosum area identification. ठीक है? So corpus callosum is very easy to identify. I will show you some images, but you try to remember that it's the largest commissural fiber. Now let us come to the image now. Okay. Now how to identify this kind of images? First of all, you orient yourself. I always tell the students, पहले orient हो जाओ. So as you can see, this is the cerebellum. So this is the posterior part, this is the anterior part, so this is the frontal lobe, this is the occipital lobe. ठीक है? Now this part is the corpus callosum. This part is the corpus callosum. अभी ये याद रखना, anteriorly you have the genu and posteriorly you have the splenium. Because G पहले आता है alphabetic में, it is present anteriorly, and S पीछे आता है, so it is present posteriorly. So you have the splenium on the posterior most part, and genu is a band, so this is the genu. ठीक है? और genu के आगे you have another structure, that is the rostrum. Okay, you have a rostrum in front of the genu, then you have a band that is known as genu, and then you will have the body. You will have the body, and पीछे you will have the splenium. ठीक है? First of all, whenever you get an image, पहले orient हो जाओ कौन सा anterior है, कौन सा posterior है. Just see the cerebellum. So after seeing the cerebellum, you got to know this is the posterior, this is the occipital lobe, this is the frontal lobe. अभी हमको पता है कि G पहले आता है, then the S in the alphabetical order. So G genu पहले आएगा, splenium बाद में आएगा. So genu मतलब band. Genu का meaning है band. अगर बेंड है तो उसके आगे कुछ एक आना होगा, तो दैट इज द रोस्ट्रम. सो इफ यू गो फ्रॉम द एंटीरियर टू पोस्टीरियर, ऑल्सो RGBS ना, RGBS. ठीक है? जैसे RCB है, ओके, यू नो IPL टीम RCB, वैसे RGB. ओके, सो RGB पहले आता है रोस्ट्रम, देन आता है जेनु, फिर आता है बॉडी, फिर आता है स्प्लेनियम. Okay, that is the way you remember the parts of the corpus callosum, and it's very easy to identify. First of all, you have to get oriented. Okay, पहले image देखो and orient हो जाओ, कौन सा anterior है, कौन सा posterior है. Okay, now let us come to the commissures. We have studied about the anterior, posterior, habenular and hippocampal commissure. So पहले हमको identify करना है the corpus callosum. So you know that this is the corpus callosum. ठीक है? ये हो गया corpus callosum. Now you can see in front, okay, this is the posterior part, this is the anterior part. ठीक है? मतलब ये हो गया आपका जेनु, ये हो गया आपका स्प्लेनियम. ठीक है? And this is the body, and this is the rostrum. फिर इसके आगे आएगा लेमाइना टर्मिनलिस एंड उसके बाद यू कैन सी अ बल्ज हियर. दिस बल्ज इज द एंटीरियर कमिशर. तो एंटीरियर कमिशर आगे रहेगा एज द नेम सजेस्ट एंड इन फ्रंट ऑफ द रोस्ट्रम जस्ट आफ्टर द लेमाइना टर्मिनलिस. ठीक है. तो एंटीरियर कमिशर एंटीरियरली टू द anterior part of the corpus callosum. Okay. एक और चीज, when you have identified the splenium, okay, you have identified the splenium. Splenium के just नीचे you will get a bulge here, and this is the pineal gland. Just below the splenium you will see the pineal gland. Okay, this is the thalamus. ठीक है. थैलामस अगर ऊपर हो तो हाइपो मतलब नीचे, so the hypothalamus will be this one. This is the hypothalamus, this is the thalamus, this is the pineal gland. ठीक है. Okay, so you can also see the one more important thing they might ask you to identify in this image. Let me show you that you know that this is the corpus callosum. Okay, and this sulcus is the callosal sulcus. अब इस callosal sulcus में कौन सा artery lodge करता है? Sometime they might ask you about this artery, and this is the ACA, that is the anterior cerebral artery. So the callosal sulcus is lodging the anterior cerebral artery. ठीक है? So that's how you got to know this is the anterior commissure. Let us come to the posterior commissure. Now the posterior commissure, it crosses the midline through the inferior lamina of the stalk of the pituitary gland. तो हमने उस image में we have located the stalk of the pineal gland, sorry. So in this image we have located, this is the pineal gland. Okay, this is the pineal gland. Okay, so if you trace the pineal gland, the inferior stalk, then you will get the inferior lamina of the pineal gland, then you will get the posterior commissure. So you can see here, as I told you, anterior commissure, this is genu and this is the splenium. Okay. Now they have shown here, this is the posterior commissure. Okay, posterior commissure. उसके just ऊपर you will have another bulge, that is the habenular commissure. पहले आएगा posterior and उसके just ऊपर आएगा habenular commissure, and then you can also see the hippocampal commissure here. So if you trace the anterior commissure backwards, you will get the hippocampal commissure. ठीक है. Okay. So if we see in this image, as we have seen, this is the pineal gland. So just on the inferior lamina of the pineal gland, somewhere here, you will have the posterior commissure. Okay, you will have the posterior commissure. Then you also have the hippocampal commissure, a commissure of the fornix. It connects the two crura of the fornix of the two sides and forms the hippocampal formation. Okay, and this is the connection between the two fornix. And the habenular, it will cross to the superior lamina of the pineal gland. So जो habenular है, it will present in the superior lamina, and posterior commissure will be present in the inferior lamina, ठीक है, of the pineal gland. So you can see another image here. Okay, you can see another image here. It's a very beautiful image of the cadaver. Okay, very clearly seen. Now first of all, orient yourself. I already told you, you have to orient yourself. So first you see the cerebellum, this is the posterior, this is the anterior. So इधर रहेगा genu, इधर रहेगा splenium. ठीक है. So मैंने बोला था genu के just नीचे you will get the anterior commissure. ठीक है. Now if you trace the anterior commissure back side, you will see the fornix. Okay, if you trace the anterior commissure पीछे, if you trace it like that, you will get a fornix, and the connection in the fornix is the hippocampal commissure. इधर रहेगा hippocampal commissure. Now if you can see the splenium, okay, and there is a suprapineal recess here. Okay, so recess के नीचे इधर रहेगा तुम्हारा pineal gland, and in the inferior lamina you will have the posterior commissure, and if they ask about the habenular commissure, it will be somewhere in the superior lamina. ठीक है. Similarly, you can see here, this is how they have shown you. Okay, all the nuclei and the habenular, you can see the habenular part here, the pineal gland here. Okay, similarly, just see here in this image, you can see the pineal body here. Okay, pineal body के नीचे का जो lamina है, that will be your posterior commissure, और जो तुम्हारा ऊपर का lamina होगा, that will be your habenular commissure. ठीक है, so that's about the uh, commissural fibers. Let us come to the projection fibers. Okay, now what do you mean by projection fibers? Projection, as the name suggests, it is going to project somewhere. ठीक है, so this is going to connect the cerebral cortex to the subcortical centers. Subcortex के just नीचे you have certain centers like your corpus striatum, you have the thalamus, you have the brainstem. These are the subcortical centers. So cerebral cortex to the subcortical center and the spinal cord को जो connect करेगा उसको बोलेंगे हम projection fibers. As you can see here, these fibers which are going to decussate also, these are your projection fibers, and these fibers will project and radiate throughout the cortex. It is going to radiate as a crown. If you see from upside, all these fibers are radiating, and if you see from upside, it looks like a crown, and that's why the name came as corona radiata. So if a question comes on corona radiata, okay, it is a projection fibers, and projection fibers are of two types, corticofugal and corticopital. Fugal matlab go away from the cortex to the centers in the other part of the CNS, and corticopital matlab come to the CNS, okay, come to the cerebral cortex from the other centers. So corona radiata, internal capsule, fimbria and fornix. Major fornix, minor fornix. So not major and minor, these are the forceps. Okay, forceps, majors, those are different thing. But fornix, fimbria, corona radiata and internal capsule, those are the corticopital fibers, and those are the projection fibers. So if they ask you about the internal capsule, it is the projection fibers. ठीक है? If they ask about the corpus callosum, it is the commissural fiber. So that's what we have taught, just learned. Agar two sides of the hemispheres are connected, so that is the corpus callosum. Okay, if the fibers are projecting and decussating, these are your projection fibers. Okay, and then you have the association fibers, which are on the same side of the cerebral hemisphere. So that's how you try to remember. Dono side mein, that is commissural. On the same side, association. And if they're projecting and decussating from lower to upper part, that is the projection fibers. Now, which of the following structures, I think you should able to answer this, connects the Broca's area with the Wernicke's area? So they have given the option, the arcuate fasciculus, the anterior commissure, the corpus callosum, and the fornix. So this is mostly they have missed for the same side, okay, for the same side. So anybody who wants to answer this in the chat? So which of the following structure? Yes, the answer, correct answer, you are right, that is your arcuate fasciculus. हमने अभी पढ़ा है कि Broca's and Wernicke on the same side are connected by your association fiber, that is arcuate fasciculus. Arcuate fasciculus. Just now we have seen this image. This is the Wernicke area, superior temporal gyrus. This is the Broca's area, inferior frontal gyrus, motor speech area, and those are connected by your association area, that is association fiber, that is the arcuate. And this is your short association fiber, okay? Arcuate fasciculus, short association fiber. Yes. Yes. So it is also responsible, yeah, you are right, it is also responsible for your conduction, aphasia, okay? You have mentioned about the conduction aphasia, yeah. Okay. Okay, now let us come to the internal capsule. Okay, internal capsule अभी हम लोग ने पढ़ा है. What is that? Internal capsule, what did we study? It is a projection fiber. Okay, projection fiber between the thalamus and the caudate nucleus medially and lentiform nucleus laterally. ये हमेशा याद रखना, L for lentiform, L for laterally. Okay, L for lentiform and L for laterally. Now it consists of your ascending and descending nerve fibers which will connect your cerebral cortex to the brainstem and spinal cord. So as you can see, the internal capsule. So a question has been asked on the internal capsule scan or cadaveric image. I don't know, but it came from the record this July. Okay, so you can see this area V-shaped structure. Okay, this is the internal capsule. So the caudate nucleus and the thalamus are present on the medial aspect, and the lentiform nucleus, which is again divided into globus pallidus and the putamen, are present on the on the lateral aspect. L for lentiform, L for lateral. Okay. Now, what are the parts of the internal capsule? We have already we already know here that if there is a bend, अगर bend है मतलब that is genu, and then you have an anterior limb, you have a posterior limb, you have a retrolentiform part that is behind, and you have a sublentiform part. Okay, those are the parts of the internal capsule. So let us come to certain scans. Before that. I think a question came on the internal capsule. Okay, so this is a recent question which has been asked on the internal capsule. So identify the mark area. Okay, can you see here? So they have asked about this area in the recent exam. Okay, in the July exam they had asked about the internal capsule. So some people told that it came as a scan, some told that it came as a cadaveric image. So I don't know which is asked, but they asked this. Okay, either a scan. If they have given a scan, then next year they might give a cadaveric image. अगर cadaveric दिया है तो scan दे सकते हैं. So you can just see. First of all, you get oriented. Okay, with the image. पहले orient हो जाओ. Okay, now you can see in this image, as I have told you, you can see a V. You can see a V here. Okay, and that is the internal capsule. Now I have told you that caudate nucleus and thalamus is present medially and lentiform is present laterally. Okay, if they have asked about if they have okay, you have told about cadaveric image. Okay, so they have asked in a cadaver, you might also get a scan next time. So the scan has been asked in 2023. So see how they are changing the pattern. So in 2023 they have asked about a scan, and in 2024 they are asking about a cadaver. So you have to see both ways. ठीक है, scan भी तुमको समझ में आना पड़ेगा कि ये कौन सा क्या है, and in the cadaver also. So I am showing simultaneously. So you can see here that if you can see the white area, this V is the internal capsule. The caudate nucleus is above the head of the caudus. The thalamus, ऐसे याद रखना कि LTC, ठीक है, LTC, okay, LTC. So L laterally, T नीचे and C ऊपर. Okay, and lentiform is on the lateral aspect, caudate is above, thalamus is below. ठीक है, so if they have asked cadaveric, then you might be asked also the CT scan. ठीक है, so you can see here in the CT scan this structure, this V is the internal capsule, this is the caudate nucleus, this is the thalamus, and this is the lentiform nucleus. ठीक है, so the correct answer here is the internal capsule. Okay, chalo. Okay, so I am going to start this series on the scans now, because they might ask a question on the scan as well. So identify the arrow mark in the given radiograph. So can you identify this? What is this? Any answer? What is this mark area in the given radiograph? Anyone in the chat who wants to answer this? First get orient yourself. If you have seen this, this is the cerebellum. So this is the posterior most part, this is the anterior most part. What is the mark area? What is this? What is this mark area? Anybody? It's very easy. What is this marked area? Yeah, it's no. The answer will be pons. So it's not midbrain. Okay. So midbrain, as you can see in this image, okay, it's a part. They might ask you any part of the brainstem every time they are asking. So you know that midbrain will be here. This is the midbrain. Okay, and this bulge, anywhere you see this bulge, it is directly pons. Okay, this is pons, and उसके नीचे you have the medulla, और उसके बाद it will continue as a spinal cord. Okay, so this is the midbrain, this is the pons. If they have given this area, marked area, so the answer will be pons. Okay, you can see this is the lateral ventricle, fornix, thalamus. Okay, so it's very easy to, अगर ऐसा bulge होगा, that is pons, this entire area is your brain stem. ठीक है, मिड ब्रेन पॉन्स मेडुला, एंड मिड ब्रेन पॉन्स के इस बल्ज के ऊपर होगा, बल्ज के नीचे होगा मेडुला, और ये बल्ज होगा पॉन्स. ठीक है, so the answer here will be your pons. Okay. Okay, so similarly in the cadaveric image, see I am showing you the scan as well as the cadaveric image so that you don't get confused. So this entire thing is the brain stem. Okay, so ऐसा bulge दिखेगा, anywhere you can see this bulge, this is pons. उसके ऊपर होगा mid brain. ठीक है, pons के ऊपर होगा mid brain और pons के नीचे होगा medulla. Okay, so next time they might ask you a cadaveric image, and this one is the cerebellum, so this is the posterior part, this is the anteriormost part. Either this part is the thalamus. If you go from down below to upwards, medulla, pons, midbrain, उसके ऊपर thalamus, उसके ऊपर corpus callosum. ठीक है, so anywhere you see this bulge, and behind this bulge you will see this cerebellum. ठीक है, behind the pons, behind this entire brainstem, you can see the cerebellum. So any bulge you can see in the anteriormost part, bulging is on the anteriormost part, so that is the pons. Okay, so they might ask a cadaveric as well as a scan. Okay, what is this? Identify the mark arrow in the given radiograph. What is this? Can you now this session is different. Okay, this is an axial session, so they can give you different type of section. They can give a sagittal, they can give a transverse, they can give an axial, any type of section they can give an ask. So what is this? If you can answer this, what is this? Anyone in the chat who wants to answer this? What is this answer? In the section, what is this? We have taken an axial section of the scan, and the answer here, yes, the answer here is midbrain. Yes, you are right. So you can see here, this is the midbrain. Okay, this is the midbrain. The answer here is the midbrain. In the axial section, this is the midbrain. Okay, now let us study a little bit about the midbrain. So you know that it connects the pons to the diencephalon and the cerebrum. Okay, and the cavity is your, if they ask you the cavity, then that is the cerebral aqueduct of Sylvius. Okay, and connects the third ventricle with the fourth ventricle, as you know. Now there are two parts, very, very important. So one part is known as the tectum. Tectum is lying dorsal to the transverse line drawn through the cerebral aqueduct. Okay, now this is lying dorsal. Okay, and it consists of your superior and inferior colliculi. Now you know that there are two collicules, two superior, two inferior. Now as a group it will be seen as four collicules, so that's why it is known as your corpora quadrigemina. And then you have a cerebral peduncle. Now cerebral peduncle will be lying ventrally, matlab anterior to the transverse line, and this peduncle consists of three parts, from the anterior to the posterior part. The most anterior part is the crus. Okay, the most anterior part is the crus cerebri. It is also called basis pedunculi. Then you have the sustension nigra, and then you have the tegmentum. Okay, so as you can see here, so just this is a division. You have the tectum and the cerebral peduncle. Okay, the tectum is lying posteriorly, the cerebral peduncle is lying anteriorly. Then in the cerebral peduncle, again it is divided into crus cerebri, the sustension nigra, and the tegmentum. As you can see in this image, Okay, so the cavity of the midbrain is the cerebral aqueduct. Okay, now if you draw a transverse line like this, okay, now the anterior most part, that is the cerebral peduncle, it is anterior, and tectum, it is lying dorsally, it is posterior. Okay, now in the cerebral peduncle you have the most posterior most part. The most posterior part is this one, that is the tegmentum. Then you have a pigmented area, that is known as the substantia nigra, and uske baad you will have the crus cerebri. The crus cerebri, and in between you have the interpeduncular fossa. Now again this crus cerebri is divided into the medialmost part, that is the corticopontine fiber. In the middle you have the corticospinal and the corticonuclear, and on the lateral most part you have the again corticopontine fiber. Okay, so those are the fibers we will study later on, but for now you have to know that anterior part is the cerebral peduncle and posterior part is the tectum. Okay, behind this area is the tectum. Okay, और आगे का जो entire area है, this is the cerebral peduncle. Again peduncle is divided into the substantia nigra and your crus cerebri and then tegmentum. ठीक है, so you can see here, as I have told you just now. ठीक है, what is this? ये क्या है? ये है cerebral peduncle. Peduncle is lying anteriorly and tectum will be lying posteriorly. Also you can see in the CT scan, you can see the orbit. So you know this is anterior, this is posterior. ठीक है? And next time they might ask you, what is this part of the midbrain? Okay, next time the question might come on the parts of the midbrain. So if they ask you about this part, this is your cerebral peduncle. If they ask about this part, this is the tectum. Okay, in between you will have the cerebral aqueduct, and in a tectum you will have the four colliculi, the superior colliculi and inferior colliculi, that is the corpora quadrigemina. Okay, I hope it is clear to you now. Okay, so similarly this is again the you can see here they have shown you this is the cerebral peduncle. Okay, they have shown you the cerebral peduncle, this is the tectum, you can see the cerebral aqueduct. Okay, and they have also shown you an artery here, that is the medial cerebral artery. Okay, so very common this type of scans, they might ask anything about that. So you can see certain views of the scans so that you don't get confused. So one view is the axial view. Okay, one is the axial view, other is the coronal, the view which will go the suture. You know that the coronal suture divides into anterior and posterior, so this is the coronal view. Sagittal is dividing the entire brain into two equal halves, so this is the sagittal. Axial, if you cut it and you see from up, then it is the axial view, so this is the axial view. Similarly they have shown here T1 and T2 with images. Okay, so you should know about this three view, that is coronal, sagittal and axial. Okay, so the question we got is on the axial view. Okay, they might give a coronal view as well and they might give a sagittal view. So all you should know the structures in each views. Okay, on what are the structures. If you are studying about the cerebellum, then what is how the cerebellum looks in the coronal, not coronal, in the axial, in the sagittal. Okay, how the midbrain looks, you have to know about that. Now you can see a view here, that is the coronal view. Okay, next time they might give you a coronal view. Okay, and in the coronal view, okay, this has been taken from the posterior aspect. You can see here that this entire structure is the brainstem. Okay, and they might give an arrow on the midbrain. Okay, this is the midbrain, this is the pons, and this is the medulla. Okay, and then below that you have the cerebellum. Okay, you can see the falx cerebri here, the falx cerebri. Okay, the corpus callosum and the lateral ventricles. And then you can also see the caudate nucleus and the putamen, okay, and the hippocampus. They have also shown you the Sylvian fissure. Okay, and this is about a fox cerebri, and then you can see the tentorium cerebelli, that is the dural folds. Okay, so they might ask you about the midbrain. They might give an arrow here. Okay, in this image. Next time you might get a question. You might get a question in the coronal view, and they might ask what is this. So that is the midbrain. They might give you ask about this. This is the pons, and below this is the medulla. The arrow can be anywhere. What is this? This is the corpus callosum. Okay, what is this? This is the caudate nucleus. Okay, so you might get a question on your the axial scan as well, or the coronal scan as well. So you have to see the views from everywhere, all sides. सब साइड से देखना होगा कि axial में कैसा दिखता है, pons, medulla and midbrain, in the coronal how it looks. Okay, so that you don't get confused. ठीक है, understood? Okay, now let us study this. This came on 2021. So, which of the following are true except? Okay, so they have given A. Okay, can you see the A here? This is A. Okay, they have mentioned A as caudate nucleus. Then B they have given thalamus. Okay, C they have given. Okay, C they have given the lentiform, and D they have given the internal capsule. Okay, so what is wrong in this? What is wrong in this? Anybody who wants to answer in the chat? So they have asked you which of the following is not true. Okay, so as you can see in this image. Okay, now what is this section? ये कौन सा section है? What is this section? How is it taken? Yes, so the answer, you are right that D is not correct. Okay, so first you see here that okay, so you know that there is a V here. Okay, this V is the internal capsule, as we know that you can see a V here. This is the internal capsule. ठीक है, अब इंटरनल कैप्सूल के ऊपर होगा कॉडेट न्यूक्लियस एंड नीचे होगा थैलामस, एंड दिस विल बी योर लेंटिफॉर्म न्यूक्लियस. सी, सो दे हैव मेंशन लेंटिफॉर्म न्यूक्लियस करेक्ट, थैलामस करेक्ट, कॉडेट न्यूक्लियस करेक्ट, बट दे हैव मेंशन डी एज इंटरनल कैप्सूल विच इज रॉन्ग. ओके, सो द इंटरनल डी जो है वो क्या है? नाउ व्हाट इज दिस डी? एक्चुअल में क्या है? व्हाट इज दिस डी? What is this area? What they have actually mentioned. So they gave a question that this D is internal capsule, which is wrong. So next time they might ask you about this area. What is this area? Okay, so let us study about this area as well. So the answer here is D, internal capsule. It is obviously wrong. Okay, no, D is not thalamus. Sorry, D is not thalamus. No. ठीक है, थैलामस तो इधर है, थैलामस इधर है, कॉडेट न्यूक्लियस इधर है. ठीक है, एंड ये तो लेंटिफॉर्म न्यूक्लियस है. उसके बाहर यू ट्राई टू रिमेंबर दिस इज अ वाइट मैटर. ओके, सो इट विल बी फाइबर्स, इट इज नॉट ग्रे मैटर. ओके, यू थैलामस इज न्यूक्लियाई, composed of nuclei, it's a gray matter. So this area, what is this area? So D, let us study about D as well. So in this session you can already see certain structure that this is the caudate. Okay, and they have also shown you some anterior commissure, but let us come here. Okay, so they have asked about this area. Okay, this area mostly they have asked about this white area. So what is that area? So before that, let us study a little bit about the basal ganglia so that you can understand. Okay, so what is basal ganglia? Basal ganglia, it is a large subcortical mass of grey matter located within its cerebral hemisphere, as you all know. And what are its part? You have the caudate nucleus, you have the lentiform nucleus. In the lentiform nucleus, you have the putamen and the globus pallidus. Okay, and then you will have a amygdaloid nuclear complex, and you have a structure that is known as the claustrum. ठीक है. Now if you see in this image, okay, as you can see, this V, what is this V structure? This is the internal capsule. Okay, दिस इज द इंटरनल कैप्सूल. उसके ऊपर हमेशा होता है कॉर्डेट, उसके नीचे होता है थैलामस. लैटरली यू हैव द लेंटिफॉर्म. लेंटिफॉर्म न्यूक्लियस इज अगेन डिवाइडेड इनटू ग्लोबस पेरिडस मीडियली एंड लैटरली यू हैव द पुटामेन. उसके बाद अगेन यू हैव अनदर वाइट मैटर. Okay, another white matter, and that is the external capsule. And then you will have another nuclei. Okay, you will have another nuclei. So that is the claustrum. So you have to see the question properly. Okay, now as you can see here in this image, let us study this image again. So this is the white matter. So this is a white matter. This is the internal capsule. ठीक है. Gray matter will be nuclei, as you already know. So this is the chordate nucleus, this is the thalamus, and this is the lentiform nucleus. ठीक है. उसके बाहर you have another white matter. They have given the arrow in a white matter, so that is the external capsule. और उसके बाद you have another layer of gray matter. This area is the gray matter. Okay, you have another layer of gray matter as well. So if they have given the arrow in the gray matter, then that is your claustrum, because we know that basal ganglia is a accommodation of your nuclei. अगर ग्रे मैटर में एरो है देन इट इज क्लॉस्ट्रम. अगर वाइट मैटर में एरो है देन इट इज योर एक्सटर्नल कैप्सूल. सो द डी इज एक्चुअली हियर, द डी इज योर external capsule. Okay, the D is external capsule, not internal capsule. Okay, so always try to remember wherever you have the word capsule, okay, that is white matter. Okay, and it will look white, that is full of fibers. ठीक है, white fibers, white matter. So if they have given the arrow in this area, that is internal capsule. अगर white matter में ओके लेंटिफॉर्म के बाहर वाइट मैटर में एरो है, इफ द एरो इज इन द वाइट मैटर देन इट इज एक्सटर्नल कैप्सूल. इफ द एरो इज इन दिस एरिया, ओके द एरो इज इन दिस एरिया, द ग्रे मैटर, इधर में एरो होता, सो दैट इज योर क्लॉस्ट्रम. ठीक है, आई होप इट इज क्लियर टू यू नाउ. Now there is one more thing I want to tell, that okay, okay, so similarly you can see here in this image they have simply given this question. Okay, इधर से उठा के दे दिया है, just labeling हटा दिया, and they have asked this question. So you can see here again. So this is the white matter, okay, internal capsule. This is thalamus, this is chordate, okay, this is lentiform. उसके बाहर this area, this white matter which I have shaded with yellow, this is your external capsule, and उसके बाहर जो gray area है that is your claustrum. ठीक है. Similarly you can see here as they have shown here, this is the internal capsule, and this is this slight white matter. The line of white matter is the external capsule. ठीक है. See, they have similarly given same kind of image they have asked. Similarly, as we have already seen the scans, so these are the limbs of the internal capsule. Then this is your splenium here. Okay, you can see the splenium here, and genu of the corpus callosum will be here. So you also, okay, so they have given the scan. And one more thing I want to explain about the parts. So you can see, yeah, so you can see here that this is the anterior limb, okay, this is the posterior limb, and this red color is the external capsule. ठीक है, और ये हो गया आपका लेंटिफॉर्म न्यूक्लियस. ठीक है. Okay, now there is another thing that is called as extreme capsule. Extreme capsule. Now I told you that whenever there is capsule, यू नो डैट कैप्सूल मतलब वाइट मैटर, ठीक है। कैप्सूल अगर रहा anywhere there is the mention of the word capsule, that is white matter. So you try to remember, see this blue color, is a lentiform nucleus, it is a part of basal ganglia, ठीक है। Again there is a gray matter, and that gray matter, this one, this is a claustrum, ओके, दैट इज ऑल्सो ग्रे मैटर, ठीक है। उसके बाद और एक ग्रे मैटर है, उसको बोलेंगे हम लोग इंसुला, ठीक है। तो हम लोग को मिल गया है 3 ग्रे मैटर, और 3 ग्रे मैटर के बीच में है 2 वाइट मैटर। सो इंटरनल कैप्सूल तो एकदम अंदर है, बाहर बिटवीन द क्लॉस्ट्रम and the lentiform nucleus, the white matter is the external capsule, and between the claustrum and the insula, the white matter is the extreme capsule. Okay, so the extreme capsule will be the outermost white matter. Okay, you have the claustrum, outer to the claustrum is the extreme capsule, and below the claustrum it is the external capsule. Okay, I hope it is clear. Let us see in this image again. देखो ये इमेज को ध्यान से देखो, दिस इज द लेंटिफॉर्म न्यूक्लियस, ठीक है, दिस इज द लेंटिफॉर्म न्यूक्लियस एंड दिस इज द ग्रे मैटर। उसके बाद हमको और एक ग्रे मैटर दिख रहा है, दैट ग्रे मैटर इज द क्लॉस्ट्रम, ओके। और एक ग्रे मैटर दिख रहा है, दैट इज द इंसुला, okay, so we have got 3 gray matter, one is the lentiform, one is the claustrum and one is the insula. इन दोनों के बीच में 2 white matter है। So this one is the external capsule, ये white matter is the external capsule, and this white matter here is the extreme capsule, ठीक है। So lentiform nucleus, external capsule, claustrum, extreme capsule and उसके बाद insula. Okay, I hope it is clear. So you can see that if you come from outside, you can see that पहले gray matter मिलता है, that is insula, ठीक है। white matter मिलता है extreme capsule, extreme सबसे बाहर, फिर उसके बाद फिर से gray matter मिलता है, that is claustrum, उसके बाद फिर से white matter मिलता है, that is external capsule, उसके बाद फिर से gray matter मिलता है lentiform, okay, now this is putamen and here you have globus pallidus, उसके बाद फिर से white matter मिलता है, that is internal capsule, understood? So बाहर से अंदर पहले आएगा insula, gray matter, white matter I have drawn with yellow color. Let me draw the internal capsule with your yellow color. So the white matter is in yellow color. So gray matter आ गया insula, पहले एकदम बाहर से you have the insula, then you have a white matter, this is the extreme capsule, then आएगा claustrum, then आएगा external capsule, then आएगा lentiform, you have the putamen, globus pallidus, then you got the internal capsule, ठीक है। ये है chordate, ये है chordate is again this gray matter, this is chordate, this is thalamus, below you have the thalamus, okay। So this is how it is, questions are framed. So सबसे बाहर कैप्सूल जो होता है, that is yours, the outermost capsule is extreme, उसके बाद आएगा external, then आएगा internal, और सबसे बाहर वाला gray matter is insula, then claustrum, then you will get lentiform, ठीक है। I hope it is clear to you now. So this might be asked in the next exam, okay। Yeah, so we have ended this part, the gray matter, the basal ganglia. Now we are going to study about the blood supply of the brain. So any doubt in this part, you can ask in the chat. Any doubt? I hope the external and extreme is clear to you, right? No doubt? Okay, so let us start with the blood supply of the brain. Very, very easy topic, and every time there is a question, one question from the branches of the artery or on a venous drainage. So it's very common. So let us study one by one blood supply. What do you mean by blood supply? Blood supply is mostly artery and vein. दोनों होता है. It is not only artery, the venous drainage is also under blood supply. So in the brain, as I have told you about the cerebrum, so you have a superolateral surface, you have a medial surface, and you have an inferior surface. So in the superolateral surface, always try to remember that most of the, like around 80% of the blood is by the middle cerebral artery, MCA. 80% is by the MCA. Okay, there is a small 1-inch margin on the upper part. Okay, that is by the ACA, and the piche, the visual area, the posterior part is by the PCA. Okay, this is about the superolateral surface. So MCA. Okay, so MCA is supplying the major portion in the superolateral surface, only a small portion by the ACA, and the posteriormost part is by the PCA. Similarly, you can see the arteries here. Okay, what about the medial surface? If you have cut the brain through a sagittal plane and you have seen from a medial aspect, so you know that this is the medial surface by identifying one feature, that is the corpus callosum. So this is the medial surface. Now you know that see, this is the splenium and this is the genu. So this is the posterior part, this is the anterior part. Now the maximum blood supply on a medial surface is by the anterior cerebral artery, and you know that anterior cerebral artery is present in the sulcus. What is that sulcus? Anybody? Just now I have told, this is the corpus callosum. This is the corpus callosum. So there is a sulcus here. That sulcus is known as your callosal sulcus, and the callosal sulcus lodges one artery, and that artery is your anterior cerebral artery. A question from the NEET PG which might be asked in the FMGE as well. So callosal sulcus lodges your ACA. Try to remember, ACA is supplying 80% in the medial surface. The posterior part is supplied by again PCA, and the temporal part is supplied by your MCA. Okay, only the temporal lobe, only around 5% is supplied by the medial cerebral artery. Baki medially the entire part is supplied by ACA, and posteriorly it is by PCA, and only the temporal part is supplied by MCA. So you can see here. Okay, and you can see this branch, the pericallosal branch. This is a branch of your anterior cerebral artery. Okay. What about the inferior surface? You have taken the brain and you are seeing from inferior surface, and you know that inferior surface has your orbital part and tentorial part. Okay, the orbital part and the tentorial part. Now the tentorial part is mostly supplied by the posterior cerebral artery. Okay, now the orbital part, it's very important to see here. The orbital part, the medial most area, is supplied by anterior cerebral artery. This is the gyri recti. Okay, what is this? This is the gyri recti, that gyrus. And that H-shaped sulcus on a lateral surface, okay, you can see this lateral surface, this is supplied by the medial cerebral artery. It's supplied by the medial cerebral artery. Also the part of the temporal lobe is supplied by the medial cerebral artery. The anteriormost part of the temporal lobe is supplied by the medial cerebral artery. So the tentorial part is supplied by the PCA, the orbital part, the medialmost part is supplied by ACA, and the lateralmost part is supplied by the MCA. So that is about the blood supply, the arterial supply on the surfaces of the cerebral hemisphere. Let us come to the most common questions which is to be asked in the first year MBBS, that is your circle of Willis. Okay, now you know that circle of Willis is an anastomotic channel present in a interpeduncular cistern, asked in the NEET PG. So it might come in the FMG as well. What is the location of your, in which cistern do you get the circle of Willis? So it is the interpeduncular cistern, or you can say interpeduncular fossa. Okay, now it is the anastomotic channel between the internal carotid artery branches and the vertebrobasilar artery branches. Okay, so that is the anastomotic channel. Now, as you can see in this cadaveric image, now you know that how the circle of Willis is formed. I hope you remembered. So you know that the two vertebral artery. Okay, let me show with a different color. The two vertebral arteries from both side. Okay, there are two vertebral arteries. They will join to form the basilar artery. Okay, now the basilar artery is giving a branch, that is the posterior cerebral artery. Now you always try to remember that this is from the vertebrobasilar system, the posterior cerebral artery. Okay. Okay, now again from the internal carotid artery, okay, you are going to get from the internal carotid artery, you are going to get the anterior cerebral artery. So the anterior cerebral artery is from the internal carotid artery, and then you are going to get the anterior communicating artery. Okay, and also these two are from internal carotid artery branches, and the posterior cerebral artery are joined by the posterior communicating artery. Okay, so this is the posterior communicating artery, and they are forming like a circle, so that's why they have name as circle of Willis. So you have seen that two vertebral artery joined to form the basilar artery. Basilar artery is giving the posterior cerebral artery. Udhar se aayega posterior communicating artery, and from the internal carotid artery you have the ACA and the anterior communicating artery. So they are forming a circle, that is your circle of Willis, right? So here you can see so this is the basilar artery. Okay. Okay, this is the basilar artery, and then it is giving here the posterior cerebral artery. Okay, this dividing here and giving the posterior cerebral artery, and then you have the posterior communicating artery as well, the posterior communicating artery. Now from the internal carotid artery, okay, you have the anterior cerebral artery, and you will also get the anterior communicating artery as well. Okay, so this entire thing, they are forming like a circle, and that is known as the circle of Willis. Now what is important in the circle of Willis? Before going to that, we have to study about the branches of the internal carotid artery. So you know that the internal carotid artery, the entire brain is supplied by the internal carotid and the vertebrobasilar system. Okay. Now internal carotid will arise from the terminal branch at the bifurcation of common carotid at the neck, and there is a question in the NEET PG at which cervical level. So the answer is your C4. Internal carotid gets bifurcated into like common carotid, say internal to external at the level of C4. Okay, so you can see here how this common carotid, okay, and then it is bifurcating into external carotid and internal carotid at the cervical level C4. Now in between this you have a baroreceptor aortic sinus. Okay, so mostly we do that carotid massage, okay, for to activate this baroreceptor. So you have a carotid sinus or the carotid sinus in this bifurcation. Okay, isko bolte carotid sinus, and we can also massage in the carotid sinus. Okay, that is the baroreceptor. Now the internal carotid artery has your cervical part, that is in the neck region. You have a petrous part, in the petrous part of the temporal bone. Then you have a cavernous part, okay, in the cavernous sinus, and you have a cerebral part. Okay, these are the parts of the internal carotid artery, and we are mostly concerned with the cerebral part. We are mostly concerned with the cerebral part in the brain. So what are the branches of the internal carotid artery? The cerebral part. So the first you can see the ophthalmic artery. Okay, then you have the anterior choroidal artery, the posterior communicating artery, the anterior cerebral artery and the middle cerebral artery. Okay, so these are the branches of your internal carotid. So you can see here the different parts of the internal carotid. Okay, so this is the cerebral part. This entire part is the cerebral part, and then you have a cavernous part. This part is the cavernous, and then a small part is the petrous, and then you have the cervical part. Now you can see certain bend between the petrous part and the cavernous part. You can see a bend, and that bend is it looks like a S, and that is known as carotid siphon. Okay, carotid siphon. That S-shaped band is known as carotid siphon. So what it does, the very heavy pulsation, when it reaches the brain, this siphon, due to the siphon effect, as it is taking a bend like S, it is taking a bend like S, the pulsation decreases. Otherwise, आप सोचो कि how much pulsation we will be feeling each time when for that because of that S-shaped siphon, the pulsation is decreased. They dampen the pulsation. Okay, dampen the pulsation. Dampen the pulsation. Carotid siphon. Now we are concerned with the cerebral part. So you can see in the cerebral part, okay, the first branch you can see here, that is the ophthalmic artery. Okay, then you have the posterior communicating, okay, anterior choroidal, okay, anterior cerebral and the middle cerebral. So in the circle of Willis, the posterior communicating, the anterior cerebral, okay, the anterior cerebral, the posterior communicating, these are the branches from your internal part, that is the cerebral part of the internal carotid artery. The posterior communicating artery is a branch of internal carotid artery. It is not a branch of your posterior cerebral artery. Okay? And posterior cerebral artery is a branch of basilar artery. So you can see these branches again here. As you can see, there is a siphon form. As I told you, there is a S-shaped siphon form. So that will dampen the pulsation. Okay. Now let us come to the vertebral artery. Now vertebral artery is derived from the first part of subclavian artery. Okay, subclavian artery has parts, different parts we are going to study again. So it is derived from the first part of the subclavian artery. Now this vertebral artery has also the cervical part and the vertebral part, the suboccipital part and the cerebral part. Okay, in the cervical part, what question might be asked is that it enters the foramen transversarium, of the C6 vertebra. Okay, this part from its origin, it will enter to the foramen transversarium of the C6 vertebra, and the artery lies in the scalenovertebral triangle. So C7 के foramen से ये नहीं गुजरता है, you know that. So you can see the vertebral artery here. So this is C7, okay, and it is not entering through the foramen transversarium of C7, but it is entering from the C6, okay, as it is entering. Okay, that is the cervical part. So you can see the cervical part, and then you have a vertebral part. Okay, then you will have a suboccipital part, and then you will have a cerebral part. So we are mostly concerned with the cerebral part, as I told you. So what are the branches from the cerebral part? So you have the anterior spinal artery, the posterior spinal artery, the posterior inferior cerebral artery, very, very important, PICA. Posterior inferior cerebellar artery is a branch of your vertebral artery. Okay, this is a branch of your cerebral part of your vertebral artery. Then you have medullary and meningeal branches, as you can see here. The posterior inferior cerebral artery is a branch of your vertebral artery. Okay, and then you got the anterior spinal artery as well. You also have the posterior spinal artery, medullary branches and the meningeal branches. Okay, now what about the basilar arteries? So we already studied that the two vertebral artery will ascend up and unite at what is the location? The location is the pontomedullary junction to form the basilar artery. So a question might ask, where does the basilar artery form? So it is at the junction between the pons and the medulla, and it will lie in the basilar sulcus of the pons. So the basilar artery will lie in the basilar sulcus of the pons at the pontomesencephalic junction and divides into two cerebral arteries. Now what are the branches of the basilar artery? Now this is also important. So you have the AICA, AICA, anterior inferior cerebral artery, labyrinthine pontine superior cerebral artery, and the posterior cerebral artery. So posterior cerebral artery is taking part in your circle of Willis. So you can see here AICA, anterior inferior cerebral artery, labyrinthine pontine, and the superior cerebral artery, and the posterior cerebral artery. So now you know that the AICA is a branch of basilar artery and PICA is a branch of vertebral artery. So we have already studied PICA. If they ask you about the posterior inferior cerebral artery, it is a branch of your vertebral artery. If they ask about AICA, anterior inferior cerebral artery, it is a branch of your basilar artery. And basilar artery is formed at the pontomedullary junction. Okay. Now I want to answer in the chat. So anterior cerebellar artery. What is anterior cerebellar artery? I just now told you. It is AICA, anterior inferior cerebellar artery. Anterior inferior cerebellar artery is a branch of, they have given basilar, vertebral, subclavian and internal carotid. So I want to answer in the chat. What is the answer? Anterior inferior cerebellar artery is a branch of AICA. I just now told you PICA and AICA. PICA posterior inferior cerebellar artery and AICA is anterior inferior cerebellar artery. So AICA anterior inferior cerebellar artery is a branch of. Any answer in the chat? Somebody has given the answer B, but it is wrong. Okay, the answer is your basilar artery. Just now I have told you that AICA, anterior inferior cerebellar artery, is a branch of your basilar artery. It is a branch of basilar artery. Okay, it is a branch of basilar artery. Vertebral artery ka branch is your PICA. Posterior inferior cerebellar artery is a branch of your vertebral artery. AICA is a branch of your basilar artery. How to remember it? You know that A, B, C. Okay? And the question came as AICA and B is for basilar artery. Okay? B is for basilar artery. Okay? Try to remember only one. If AICA is from basilar, then PICA is from vertebral artery. Okay, PICA is from vertebral artery. Okay, AICA is from basilar artery. Okay, you have to remember this. Okay, just try to remember A, B, C. Okay, okay, C for cerebellar. Just try to remember cerebellar. Okay, AICA anterior inferior matlab it is coming from B basilar artery. एक ही याद रखो, ठीक है. एंड पिका पोस्टीरियर इंफीरियर सेरिबुलर आर्टरी. अगर आइका बेसिलर से आ रहा है तो पिका इज कमिंग फ्रॉम योर वर्टिब्रल आर्टरी. दैट इज पिका इज अ ब्रांच ऑफ योर वर्टिब्रल आर्टरी. ओके, right? Got it? Okay. Now I want to answer from the chat again. The vertebral artery is derived from, they have given first part of subclavian, second part, third part and fourth part. Any answer in the chat? Just now we have studied about vertebral artery. Which part of subclavian? First, second, third, fourth. Vertebral artery is derived from. Any answer in the chat? The vertebral artery is derived from. So the answer is your first part of subclavian artery. Okay, the vertebral artery is derived from the first part of subclavian artery. Now you know that the subclavian artery has, they have mentioned, I don't know why fourth part, it is of no use, not second part, it is first part. So branches of the subclavian artery, so you know they have three parts, the first, second and third. The first part has your vertebral, internal thoracic and thyrocervical trunk. Okay, you know that there is a engineering institute, that is Vellore Institute of Technology. So VIT. VIT is from the first branch. Okay, from the second branch it is costocervical trunk, and from the third branch, you know that third branch will be near to the scapula, so it will be your dorsal scapular artery. So always try to remember vertebral artery, this is internal thoracic, and this is thyrocervical trunk. The VIT, Vellore Institute of Technology. VIT is from the first part. Mostly they will ask you from the first part only to confuse you. So as you can see, this is the subclavian artery. So you can see this big branch, the first branch is the vertebral artery. Okay, the first branch is the vertebral artery. Then you have the internal thoracic. This is the second branch coming from the first part. And then you have the thyrocervical trunk. Okay, this is the thyrocervical trunk. Okay, and from the second part you have the costocervical trunk. Okay, the costocervical trunk, this is from the second part, costocervical trunk. And from the third part you have the they have not shown the branch, but it is your dorsal scapular artery, dorsal scapular artery. Okay, so VIT is the answer, that is V, vertebral artery, is from the first part of the subclavian artery. Okay, Vellore Institute of Technology, try to remember that VIT, first part, vertebral, internal thoracic and thyrocervical. Now, which of the following is a branch of the third part of the subclavian artery? Thyrocervical, vertebral, internal thoracic and dorsal scapular. I want to answer in the chat. Just now we have studied about that. So they have repeated in two sessions. First, in the first session they have asked about the vertebral artery, कौन सा part से आ रहा है. In the evening session they have asked about third part से क्या आ रहा है. So you will get the same question repeated. Okay. So I want to answer here, third part से कौन सा है among this following, which is the answer. What is the answer? Which is a branch of the third part of the subclavian artery? Any answer? Abhi just now I have told that VIT is coming from the first part. तो thyrocervical नहीं है, vertebral नहीं है, internal thoracic नहीं है. So the answer is your dorsal scapular. No, the answer is your dorsal scapular. Okay, dorsal scapular artery. Just now we have studied the last branch, that is dorsal scapular artery, DSA. Okay, VIT is coming from the internal thoracic, is from the first branch, where VIT, V for vertebral, I for internal thoracic, T for thyrocervical trunk, costocervical is from the second part, and the third part is DSA, that is your dorsal cervical, coming from the third part. Always try to remember dorsal scapular. Scapula is to, the third part will be near to the scapula, and so the answer will be your dorsal scapular. Internal thoracic is from the first part. Okay, just now I have told you VIT, vertebral, thyrocervical, internal thoracic from the first part, and dorsal scapular from the third part. Okay, I hope you understood. Now let us come to the Barry's aneurysm. So you know that aneurysm means dilatation if there is weakening of the wall of the artery. So this might be due to congenital muscular weakness. The most common site is at the junction of your ACA, anterior cerebral artery, and anterior communicating artery. Okay, and also the bifurcation of internal carotid. So where will be the most common aneurysm? At the junction of your, this is the communicating and this is the ACA. So this is the most common site, that is 40%, 20%. In the medial cerebral artery you will get 34%, in the posterior communicating you will get 20%, in the basilar you might get 8%. So these are the different type of aneurysm, but the most common question asked is the सबसे ज़्यादा विच इज़ द कॉमन साइट. सो एंटीरियर कम्युनिकेटिंग और एंटीरियर सेरेब्रल आर्टरी के जंक्शन में जो लोकेशन है, दैट इज़ योर द मोस्ट कॉमन साइट. एंड it's a rupture of varus aneurysm is a very common cause of a subarachnoid hemorrhage. Okay. Okay, now the recurrent artery of Hebner. Sometimes this questions is to come in NEET PG as well. Okay, the recurrent artery of Hebner. So it is a branch of, so it is a recurrent branch of your ACA, anterior cerebral artery. It is also known as artery of Hebner. So you know that this is the ACA. So it will give a recurrent branch, that is the recurrent artery of Hebner. Why it is important? Because it supplies your caudate nucleus, anterior limb and genu of the internal capsule. And if there is a thrombosis in the recurrent artery, so there will be very important contralateral paralysis of the face and the upper extremity, and it is also known as facio-brachial monoplegia. Okay, so recurrent artery of Hebner का thrombosis होने से contralateral paralysis of the face हो सकता है. Then another artery is the Charcot artery of cerebral hemorrhage. Now, Charcot artery is the lenticulostriate branch of your MCA. It is a branch of your middle cerebral artery. Okay, so this question came in NEET PG. Charcot artery is a branch of which of the following arteries? So they have ACA, MCA, PCA, and internal carotid. So answer will be the middle cerebral artery. And the rupture of this artery in elderly hypertensive will result in your contralateral spastic hemiplegia. Okay, I think this shading you can't see. Okay, so you will see your contralateral spastic hemiplegia and paralysis of the lower half of the face and altered sensorium due to involvement of genu and the posterior limb. So sometimes they might ask you by giving this. These are the lenticulostriate branch. One of the lenticulostriate branch of the MCA is larger, and that is the Charcot's artery. Okay, so the contralateral paralysis of the face and the upper limb is in the thrombosis of your recurrent artery of Hebner. अगर Charcot's artery में hemorrhage हो गया, then you will have contralateral spastic hemiplegia, but of the lower limb as well, because posterior limb भी involve हो रहा है. ठीक है, posterior limb भी involve हो रहा है capsule का. So if you want to see here, so this is the recurrent artery of Hubner. It is a branch of your ACA. Hubner artery is a branch of your, just now we have studied, it is a branch of your ACA. And Charcot's artery is a branch of your MCA, lenticulostriate branch. One of the lenticulostriate branch is very, very large. So recurrent artery of Hubner is a branch of ACA, and Charcot's artery is a branch of your MCA, that is middle cerebral artery. Now let us come to the blood supply of your spinal cord. So the spinal cord is blood supply. You have the anterior spinal artery, 1 in number, and 2 posterior spinal artery, and you have radicular arteries. And the pia mater covering the spinal cord also give arterial plexus. It is known as arterial vesicorona. So you can see here, you have anterior spinal artery, okay, and you have 2 posterior spinal arteries. You can see 2 posterior spinal arteries. Okay. Now this is important. As you can see here, this is the anterior spinal artery, okay, and it is supplying the anterior 2/3 of the spinal cord, and the posterior spinal artery, you have 2 posterior spinal arteries both sides. It is supplying posterior 1/3, okay, and also the this one, you can see the vesicorona is supplying the circumferentially, okay. So anterior 2/3 is supplied by anterior spinal artery, and it is 1 in number, and posterior 1/3 is supplied by your posterior spinal artery. They are 2 in number. So you will get a question on this. Okay. Now about the venous drainage of the spinal cord, you have 2 medial longitudinal channels. So you can see here anteromedial venous channels and the posteromedian venous channels. Then you have 2 paired, you can see here 2 posterolateral paired anterolateral channels and posterolateral channels as well, and they are also interconnected by plexus of vein. They are known as vasocorona. So that is about the venous drainage. So I want the answer from the chat. Anterior 2/3 of spinal cord is supplied by anterior spinal, posterior spinal, anterior communicating, and anterior choroidal. So I want from the chat an answer. Just now we have studied about the blood supply. So what is that? Anterior spinal, posterior spinal, anterior communicating, or anterior choroidal? Anybody who wants to answer in the chat? अभी हम लोग ने पढ़ा, just now we have studied, just now. The anterior 2/3 is supplied by your anterior spinal artery, and the posterior 1/3 is supplied by 2 posterior spinal arteries. So the answer, yes, you are right. So the answer is your anterior spinal artery. Okay. Now blood supply of spinal cord. is, okay, so this came in 2023, not 24. This is about 23 question. So blood supply of the spinal cord. They had given two anterior, one posterior, one anterior, two posterior, two anterior, two posterior, one anterior, one posterior. What is the answer? Come on, I need a fast answer in this one. Abhi, just now we have studied. What is the answer? Blood supply of spinal cord. Anybody? Just now we have seen. Always try to remember the first position. आगे सिर्फ एक ही होता है, but second position is occupied by many people. So anterior spinal artery is 1 and posterior spinal artery is 2. Always try to remember that first position सिर्फ एक होता है and second position में बहुत सारे लोग होते हैं. Okay, just try to remember like that. Second position 2, first position एक, आगे anterior and posterior 2. Okay, आगे anterior first position it is 1 and post पीछे it is 2. No, the answer is B, that is 1 anterior 2 posterior. Just now we have studied about that only, that you have only one anterior spinal artery but you have two posterior spinal arteries. Okay, आगे number 1 position में सिर्फ एक ही होता है, the main one, that is central spinal artery, and पीछे में दो लोग हैं, 2 for 2, that is posterior. आगे एक पीछे दो. Okay, so anterior spinal artery is 1 and posterior spinal artery is 2. आगे एक first position, आगे एक second position, posterior पीछे second position, दो arteries. So you have 2 posterior, 1 anterior spinal artery. So with that we have almost completed neuroanat part 2, and in neuroanat part 3, the remaining part I am going to discuss about the cranial nerve nuclei, little bit about the head and neck. Okay, so a little bit about the head and neck, the cranial nerve nuclei, and whatever is there, tracks. ठीक है, tracks है, spatial senses, whatever question might come on that, and cerebellum, especially there are many questions on the cerebellum. So we are going to study about the cerebellum in neuroanat part 3 along with the tracks, and whatever systems are left, you know, limbic, reticular, जो भी आता है, I'm going to study about that. Okay, and you know that this time the question came on the hemorrhage also, I think. A question came on, thank you so much. Okay, yeah, and a question came on subdural and epidural. I have already told you about epidural and subdural hemorrhage. So what do you mean by subdural hemorrhage? Subdural क्या है और epidural hemorrhage क्या है? So you know that there is a dura mater. Okay, you have a dura mater. अगर sub हो, if the word is sub means below the dura, epi means above the dura, extradural is also above the dura. So extradural or epidural is above the dura and subdural is below the dura. Always try to remember subdural is below the dura, epi or extra is above the dura. Now there is another question on a terion. Okay, so terion, we already know that there is H-shaped suture in the head, and it has your 4 bones. Okay, so and in that area it is very weakest point of the head. So if you get a blow on the terion, so artery lies beneath that. So what is that artery? Anybody can answer that? What is the artery beneath the terion? Anybody who knows that? What is the artery in the terion? What is the artery which is located in the terion? If you can answer that, it will be good for you. Wait a second. So I just want to recap the terion a bit because many questions came on that. Okay. Okay, so a question came as a patient suffered from extradural hemorrhage due to involvement of the middle meningeal artery. Okay, so the terion, beneath the terion you have the middle meningeal artery. So next time the question might come on the artery as well. So you have the middle meningeal artery and the location will be your, the answer is terion. Okay, so this question has been repeated in 2023. अगर 24 में नहीं आया तो 20 in the December section you might get a question on the terion as well. Okay, that is, the artery is your middle meningeal artery. And one more thing, I want to do a quick recap. We have 4 minutes because I have done a recall. Okay, so in the recall, in the previous session, there is a question from the neuroanatomy part, and that question was your, there is a question on the scan, I guess. Let me see. Yeah. So this was the question asked in the July 2024, that identify the type of hemorrhage in the given scan, and there was a clinical history given. Okay, so what is this hemorrhage? Just now I have told about the epidural and epidural or extradural and a subdural. So you can see पहले तो इधर में कोई फ्रैक्चर नहीं दिख रहा है, we can't see any fracture, so that is an important point. Secondly, you can see that this is a shape of crescent. Crescent मतलब half moon. Okay, half moon shape hemorrhage you can see in the scan. Now where do you get a half moon shape crescentic hemorrhage? So you know that, see, whenever you get a crescentic hemorrhage, okay, it is your, what is that hemorrhage? Crescentic hemorrhage is your subdural hemorrhage. And if you get a biconvex, a very big biconvex hemorrhage, that is your epidural hemorrhage. Okay, this is a very very important point. And also mostly in the epidural, that is above dura, you will mostly see a skull fracture. Okay, एक तो skull fracture दिखेगा, and this is mostly because of the arterial blood. Now if they have asked about the, मैंने बोला था कि terion में, this is the weakest point. If you get a blow on the terion, there will be injury to the middle meningeal artery. Okay, so mostly because of the middle meningeal artery you get the epidural hemorrhage. Now if there is an injury on the bridging veins, mostly because of the dural venous sinus, it is a subdural hemorrhage. So next time a question might come on the artery and vein of epidural and subdural. And if you see a crescent shape, okay, it is like a half moon, crescent shape hemorrhage, that is your subdural hemorrhage. अगर biconvex बड़ा दिखेगा, then that is your epidural hemorrhage. Okay, so I hope this part is very very clear to you, because this question came recently. ठीक है, ये recently आया है. So this is your, what is the answer? In this they have given epidural, subdural, subarachnoid and intracranial. So anybody, the answer here is your, obviously, subdural hemorrhage, mostly because of the bridging veins, injury to the bridging veins, that is your dural venous sinus. Okay, let me see if there was another neuroanatomy question. Yeah, so this came, okay, this also came internal capsule, which we have already marked the answer. This was your internal capsule. ठीक है, और neuroanat का mostly I think there was a question on a fracture in the nasal bridge, so that was your anosmia. ठीक है, that answer was anosmia. A question on the pterygopalatine ganglion, they have marked on the pterygopalatine fossa. Okay, so you know that this is the pterygopalatine fossa, location of the pterygopalatine fossa, and it is just below the maxillary, okay, maxillary nerve. So you have the pterygopalatine ganglion here. ठीक है, so this question came. और क्या आया था न्यूरोएनाट से? I think yeah, that much only. ठीक है, so you had anosmia, you had that internal capsule which we have already discussed, and Any more question on neuroanat? I guess this much only. The subdural and epidural, this one only I wanted to discuss. Okay. So with this I end today's topic. I hope you understood everything, and I want you to attend my neuroanat part 3, because there I will be teaching about the histology of cerebrum, cerebellum, and histology of spinal cord, because many question is to come on the histology. So the basic tricks to identify the slides and the question which might be asked on that. And a cerebellum, as you know, it is a very important topic which has been asked, and also the cranial nerve nuclei and spatial sensation. So the neuroanat part 3 will be the last maybe. Also some part from the thalamus, limbic, and the reticular system will discuss on that, and with that we'll end the neuroanatomy series. So that will be the last series. I want you to attend that series. Okay. So with that I hope you understood very well. Okay. And with that I end today's session. Any question you might ask on the chat, I will be replying in the chat as well. Okay, the comment session, and please give a feedback in the comment section that how was today's session. If you need any improvement, I will try to improve myself. Okay, any improvement, any special topics which you have not understood, I will incorporate in the next session as well. So you can give a feedback in the comment section, and any special topic you want to revise, I will incorporate. You can also mention about that. Okay, with this I end today's session. Thank you very much.